Question 1. A patient presents with a heart rate of 40 BPM, regular rhythm, and absent P waves. What is the most likely rhythm? A. Ventricular fibrillation. B. Atrial flutter. C. Junctional bradycardia. D. Sinus bradycardia. Answer: C. Junctional bradycardia. Question 2. Which of the following is the priority action for a patient with pulseless ventricular tachycardia? A. Administer amiodarone. B. Perform synchronized cardioversion. C. Begin defibrillation. D. Give oxygen via non-rebreather. Answer: C. Begin defibrillation. Question 3. What is the appropriate intervention for a conscious patient with symptomatic bradycardia? A. Defibrillation. B. Atropine administration. C. Adenosine push. D. Amiodarone drip. Answer: B. Atropine administration. Question 4. What is a distinguishing ECG characteristic of ventricular fibrillation? A. Irregular baseline with no identifiable QRS. B. Wide QRS with slow rate. C. Consistent PR interval. D. P wave followed by QRS. Answer: A. Irregular baseline with no identifiable QRS. Question 5. A patient with SVT remains unstable after vagal maneuvers. What is the next best nursing action? A. Administer atropine. B. Prepare for defibrillation. C. Administer adenosine. D. Monitor for 24 hours. Answer: C. Administer adenosine. Question 6. What condition is most likely indicated by a prolonged PR interval greater than 0.20 seconds without drop beats? A. First-degree AV block. B. Type 1 second-degree AV block. C. Type 2 second-degree AV block. D. Third-degree AV block. Answer: A. First-degree AV block. Question 7. What action is appropriate when a nurse notices an abnormal rhythm and the patient is alert and talking? A. Notify the provider immediately. B. Check lead placement and reassess. C. Begin CPR. D. Administer amiodarone. Answer: B. Check lead placement and reassess. Question 8. Which patient finding is most concerning for deterioration into ventricular fibrillation? A. Packs every 10 beats. B. PVCs and runs. C. Atrial flutter at 80 BPM. D. Sinus tachycardia at 100 BPM. Answer: B. PVCs and runs. Question 9. What priority nursing intervention is needed after a patient undergoes synchronized cardioversion? A. Begin CPR. B. Monitor for respiratory depression. C. Reassess cardiac rhythm and vital signs. D. Administer for potassium. Answer: C. Reassess cardiac rhythm and vital signs. Question 10. A telemetry strip shows chaotic rhythm with no discernible waves or complexes. What should the nurse do first? A. Start CPR immediately. B. Defibrillate the patient. C. Call the rapid response team. D. Recheck monitor leads. Answer: B. Defibrillate the patient. Question 11. What is the clinical implication of a patient showing a third-degree heart block with hypotension? A. Begin synchronized cardioversion. B. Start amiodarone infusion. C. Prepare for transcutaneous pacing. D. Administer a beta blocker. Answer: C. Prepare for transcutaneous pacing. Question 12. Which ECG change is associated with hypokalemia? A. Peak T waves. B. Shortened PR interval. C. Flattened T waves and U waves. D. ST elevation. Answer: C. Flattened T waves and U waves. Question 13. Which patient would be the priority for the nurse to assess based on cardiac rhythm? A. Sinus bradycardia with no symptoms. B. Stable atrial flutter. C. A new onset atrial fibrillation. D. Packs every 3 minutes. Answer: C. A new onset atrial fibrillation. Question 14. In sinus tachycardia, what is typically the underlying cause that must be addressed first? A. Electrolyte imbalance. B. Fever or hypovolemia. C. Cardiac ischemia. D. Beta blocker overdose. Answer: B. Fever or hypovolemia. Question 15. What rhythm is associated with a regularly irregular pattern and grouped beating on ECG? A. Sinus arrhythmia. B. Ventricular bigeminy. C. Second-degree AV block type 1. D. Junctional escape rhythm. Answer: C. Second-degree AV block type 1. Question 16. What should the nurse do immediately after witnessing a patient collapse and their ECG shows asystole? A. Check pulse and start CPR. B. Prepare for synchronized cardioversion. C. Administer adenosine. D. Administer lidocaine. Answer: A. Check pulse and start CPR. Question 17. What is the nurse's next step after identifying artifact on a rhythm strip? A. Document the artifact. B. Reposition the patient. C. Reapply ECG leads. D. Call the provider. Answer: C. Reapply ECG leads. Question 18. What rhythm typically follows untreated or repeated episodes of torsades de pointes? A. Atrial flutter. B. Ventricular fibrillation. C. Sinus tachycardia. D. Junctional bradycardia. Answer: B. Ventricular fibrillation. Question 19. What is a key sign that distinguishes supraventricular tachycardia, SVT, from sinus tachycardia? A. Slower rate. B. Presence of P waves. C. Sudden onset and very high rate. D. Irregular rhythm. Answer: C. Sudden onset and very high rate. Question 20. A patient with atrial fibrillation is on warfarin. What lab result is most important to check regularly? A. Troponin. B. Creatinine. C. INR. D. Hemoglobin. Answer: C. INR. Question 21. A patient has an irregular rhythm with no visible P waves and a ventricular rate of 130 BPM. What is the rhythm? A. Atrial flutter. B. Sinus tachycardia. C. Atrial fibrillation with rapid ventricular response. D. Junctional rhythm. Answer: C. Atrial fibrillation with rapid ventricular response. Question 22. What is the first action a nurse should take when a patient's ECG shows ventricular asystole? A. Start chest compressions. B. Defibrillate immediately. C. Administer adenosine. D. Apply synchronized cardioversion. Answer: A. Start chest compressions. Question 23. A patient with second-degree AV block type 2 has a heart rate of 38 BPM and dizziness. What is the priority? A. Administer adenosine. B. Monitor the rhythm. C. Prepare for transcutaneous pacing. D. Defibrillate the patient. Answer: C. Prepare for transcutaneous pacing. Question 24. What does a wide QRS complex usually indicate in a cardiac rhythm? A. Atrial origin. B. Normal conduction. C. Ventricular origin. D. Electrical interference. Answer: C. Ventricular origin. Question 25. A patient experiences a run of torsades de pointes. What medication should the nurse prepare to administer? A. Lidocaine. B. Magnesium sulfate. C. Epinephrine. D. Amiodarone. Answer: B. Magnesium sulfate. Question 26. What feature defines atrial flutter on ECG? A. Absent P waves. B. Sawtooth flutter waves. C. Wide QRS complex. D. Irregular baseline. Answer: B. Sawtooth flutter waves. Question 27. The UAP reports the patient's monitor is alarming for V-Tach. What should the nurse do first? A. Call the provider. B. Administer antiarrhythmic drugs. C. Check on the patient and assess for pulse. D. Silence the alarm and reassess later. Answer: C. Check on the patient and assess for pulse. Question 28. What ECG finding indicates a potentially lethal rhythm that requires immediate defibrillation? A. First-degree AV block. B. Sinus bradycardia. C. Ventricular fibrillation. D. Sinus arrhythmia. Answer: C. Ventricular fibrillation. Question 29. In a telemetry unit, which task can the RN safely delegate to a UAP? A. Interpret ECG changes. B. Notify provider of arrhythmia. C. Check blood pressure. D. Adjust alarm settings. Answer: C. Check blood pressure. Question 30. A nurse reviews a strip showing regular rhythm, narrow QRS, and a heart rate of 180 BPM. The patient is stable. What is the initial action? A. Start CPR. B. Perform carotid massage. C. Encourage vagal maneuvers. D. Administer epinephrine. Answer: C. Encourage vagal maneuvers. Question 31. A patient has pulseless electrical activity. Which action is not appropriate? A. Defibrillation. B. Identify reversible causes. C. Begin CPR. D. Administer epinephrine. Answer: A. Defibrillation. Question 32. A nurse sees tall, peak T waves and widening QRS. Which lab value should be checked immediately? A. Sodium. B. Calcium. C. Potassium. D. Magnesium. Answer: C. Potassium. Question 33. Which rhythm is most commonly associated with digitalis toxicity? A. Sinus tachycardia. B. Atrial fibrillation. C. Ventricular bigeminy. D. Junctional rhythm. Answer: D. Junctional rhythm. Question 34. Which patient needs immediate attention from the nurse? A. Sinus tachycardia at 102 BPM. B. Atrial flutter with HR of 80 BPM. C. Third-degree AV block with BP 80/50ths mmHg. D. PACs with no symptoms. Answer: C. Third-degree AV block with BP 80/50ths mmHg. Question 35. A nurse is interpreting a rhythm with P waves, PR intervals that progressively lengthen, then a dropped QRS. What is the rhythm? A. First-degree AV block. B. Type 1 second-degree AV block Wenckebach. C. Type 2 second-degree AV block. D. Third-degree AV block. Answer: B. Type 1 second-degree AV block Wenckebach. Question 36. A patient with rapid atrial fibrillation is experiencing chest pain and hypotension. What is the priority intervention? A. Administer a beta blocker. B. Prepare for synchronized cardioversion. C. Give aspirin. D. Encourage deep breathing. Answer: B. Prepare for synchronized cardioversion. Question 37. What is the nurse's responsibility during transcutaneous pacing? A. Insert pacing leads. B. Monitor the patient's pain level. C. Interpret pacing spikes only. D. Silence all alarms. Answer: B. Monitor the patient's pain level. Question 38. Which rhythm is most commonly associated with a risk of embolic stroke? A. Sinus bradycardia. B. Ventricular tachycardia. C. Atrial fibrillation. D. Supraventricular tachycardia. Answer: C. Atrial fibrillation. Question 39. A nurse is caring for a patient with frequent PVCs. What condition would worsen this rhythm? A. Hypercalcemia. B. Hypokalemia. C. Hyponatremia. D. Hypernatremia. Answer: B. Hypokalemia. Question 40. In the setting of bradycardia and hypotension, what is the initial drug of choice? A. Epinephrine. B. Atropine. C. Lidocaine. D. Adenosine. Answer: B. Atropine. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!